Good afternoon. Allegheny County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly update on the coronavirus pandemic. As Dr. Bogan will give in her report, the cases continue to remain at a high level, and she'll give the briefing on the fact that young people now are becoming obviously more, as school opens up and these things are occurring, we want to make sure that our young people are protected. We're also seeing around the region and around the country many more cancellations of big events that are happening. And it's happening for one reason, because the case numbers are going up. And we know the solution to that is vaccinations. We're pleased at the fact that here in Allegheny County, over 702,000 of our citizens have been fully vaccinated and roughly another 70,000 partially vaccinated. It's kind of that last 25% that we really want to get people vaccinated. One thing, since this vaccine has been available earlier this year, I've never run into anybody who's come up to me and said, boy, I wish I hadn't been vaccinated. But on the other side, I've run into a lot of people who said, boy, I wish I had been, or I wish my family member had, and sometimes with very, very serious consequences. So we know the vaccines work. We know how effective they are at protecting our children as school opens up again, activities. But again, if the cases spread, we're going to see more cancellations of events, of football games, et cetera, et cetera. So we want to make sure we get everybody vaccinated. Those vaccines are available, and Dr. Bogan can give you the information on that, the 211 line to reach out. So anyway, let me turn it over to Dr. Bogan for her weekly report. Dr. Bogan.
Thank you, County Executive. Good afternoon. I'll start again this week with the numbers. New case counts remain high, with the daily average of around 280, although today we did report 450 cases. And among those cases reported today, more than half were classified as probable. And I want to take a moment to explain that. So probable cases are those that are diagnosed by an antigen test or by symptoms in a person who is a close contact of a case. Confirmed cases are those with a positive PCR test. We are seeing an increase in the use of the rapid antigen tests, which resulted in the increased proportion of probable versus confirmed cases today in our data. Positivity rate remains at around 5% for the last few weeks now. Hospitalizations continue to increase slowly, but remain well below the rates during the late winter, early spring surge. Thankfully, our healthcare systems here are not overrun, which tragically the situation in other parts of our country, particularly in states with low vaccination rates. We have unfortunately seen an increase in the number of deaths in Allegheny County in the month of August. We are now aware of 46 deaths and in the month of August, and that may increase a little as there is often a lag in death reporting. So that, of course, is very unfortunate. We continue to see an increase in cases among children, especially children who are not old enough to get vaccinated. In June, 67 reported cases in children 12 and younger. In July, that number increased to 157, and in August, there were 773 cases in this age group. As a percentage of all the cases in the county each month, this was an increase from about 9% of cases in June to 12% of the cases in August. Pediatric COVID cases have been a concern of mine for many weeks. I know that children countywide are now back in school, and I wish every student and parent and teacher and staff a safe school year. To keep our school settings as safe as possible, I continue to strongly support CDC guidance for universal masking in schools, and why I continue to applaud last week's decision by Acting Secretary of Health Allison Beam to issue the public health order that she did, requiring masks to be worn indoors in educational settings. Because this order just went into effect yesterday, I don't expect to see an impact on school cases for at least a few weeks. Also, its effectiveness will be determined by the adherence to masking that takes place in educational settings. What are our case investigations showing us? Well, they continue to point to the same picture in terms of how and where people become infected with COVID-19. at large and small gatherings, and in settings where social distancing is not practiced and masks are not worn. We traced cases this week to youth football games, weddings, parties, concerts, all the usual suspects. So not much new to report today. We know that cases are going up. We know the Delta variant is driving the surge. We know that kids are getting cases more, especially those who are not eligible for the vaccines. And we know that many new cases continue to be traced back to gatherings where mitigation guidelines are mostly not observed. We also know that we have available vaccines. And now here's sort of my regular pitch I say every week. I remind you to call 211 if you have any questions about getting vaccinated. We know that the vaccines are safe, and we know that while we do have some breakthrough cases, the majority of people who become seriously ill or die from COVID are those who are not vaccinated. So the only message I would add is that let's do our best to not share the virus with one another. Whether that means wearing a mask, getting vaccinated, or any of the other small things we can all do to keep ourselves and others safe, let's all just follow the golden rule, which should help stop the virus. So thank you, and be safe and be kind.
Our first question today is from the Pittsburgh Business Times. The cases have, at least today, increased over the 300 daily mark to 450. I see almost 100 of them are under the age of 18. Are any of these tied to school outbreaks?
So we definitely have cases in schools, but the increase in cases among children started even before schools opened.
And how many of the school outbreaks are there in Allegheny County?
So there are, as I said, many cases in many schools, both students and employees. I just want to take a moment to sort of define the word outbreak, because as in epidemiology, it's defined very specifically, and sometimes people mean it something different than perhaps the health department defines it. So an outbreak, by our standards, is defined as 2 or more cases within a 14-day period that are linked to a common exposure. In K-12, we're currently aware of at least 3 outbreaks in schools, but they're all small at this point. But again, there are many more cases than 3, but you asked specifically about outbreaks.
The next question that we have is from the Pittsburgh Post-Gazette. Has there been any increase in cases from events like concerts at PNC or Stage AE?
So as I said in my remarks, we see cases from all events, right? There's not one event that's driving the number of cases. It's the additive effect of a few from this concert, a few from that concert, and together they add up to our rising numbers of cases.
This next question, also from the Post-Gazette, is how concerned is the health department about a spike in cases due to the Labor Day weekend?
The Labor Day weekend is like all the other gatherings. People get together with non-household members in large groups. So we expect, like we do expect from all of these kinds of events, some number of cases related to the weekend, the events related to Labor Day. But again, I don't expect it to be any more than we've seen from concert events or other things. So we'll just have to wait and see what comes of our case investigations.
These next questions are from WTAE. Is the number of fully vaccinated people who are hospitalized with COVID-19 a more helpful data point than the number of total breakthrough infections? And if so, why? Do you have that figure?
I think that, hospitalizations are a good marker of what's happening in our community related to severe disease. They're just different data points, and we look at both of them. So not one better than the other, just important information to look at both.
And do you have that figure?
Do I have the total number of breakthrough infections that are hospitalized? I do not have that, no.
Some have speculated that the Delta variant may peak soon. Do you expect that?
I sure hope so.
This next set of questions is from WPXI. Dr. Anthony Fauci expressed concern about images of crowded football stadiums this weekend. Are county health officials concerned about a potential increase in cases as local high schools, universities, and the Steelers return to the field?
I think I sort of talked about this last week. I think it's important for people to make personal decisions about risks and benefits of attending events versus not. But to remember, keeping physical distancing works, wearing masks, staying at outdoor events is lower risk than indoor events. And again, we will just have to see what comes with those events happening.
And this final question, also from WPXI. Are county clinics administering vaccine booster shots? And if so, for which, if any, vaccines?
Yeah, our county clinics are trying to really strictly adhere to the CDC recommendations, which is really for only those who have immunocompromised and specific immunocompromise at this time for booster vaccines. So we are offering them, but we're asking patients to have a note from their doctor that says they qualify based on their immune status to receive a booster.
And that was the final question. If there are any closing remarks.
Well, thank you, Dr. Bogan. And as you had predicted a number of weeks ago, as we begin the school year, we were going to see a rise in the number of cases, and we're certainly seeing that. We certainly want to make sure people, particularly those under the age of 12, who cannot get vaccinated yet, are protected by wearing their masks, particularly in settings, indoor settings. Obviously, the mandate that the governor's Secretary of Health put out last week that began Tuesday for people to be protected when they're in school. But we know there's a lot of gatherings that are occurring now, whether they be sporting events, concerts, conventions, all kind of things that are going on. And as I said, some of them are actually getting canceled by the private sector, deciding on their own to not have these events. But hopefully we'll see the case numbers come down. We certainly want to make sure that the folks that are unvaccinated, get vaccinated. I was at an event this morning and talking to a doctor who had 20 patients in their hospital, and he said every single one of them was unvaccinated. So we know they work. We know the vaccines work. We want to make sure we protect as many people as we can. We've done a really good job, I think, to this point, and this is an ongoing pandemic. It's not ending, but I think if we protect ourselves and protect our families, we can certainly do our best and get through it. So anyway, thank you again for tuning in, and Dr. Bogan for your work, and let's continue to have a good week. Stay safe, and as Dr. Bogan says, be safe and be kind. Thank you.
Our next regularly scheduled briefing is Wednesday, September 15th at 4 p.m. Thank you for joining us.